To begin controlling bleeding and treating for shock, the first step is to take all necessary safety precautions, including wearing gloves. The next step is to locate where the bleeding is coming from. In my case, I have a little cat scratch on my arm. To control the bleeding, you take a bandage of sorts. If you don't have a bandage on hand, a bandana will work fine, or any kind of cloth that's clean. And you apply the dressing to the wound and apply pressure. If the bleeding still continues, don't remove the dressing and put another dressing on top of it. If it still continues to bleed profusely, even with the pressure and multiple dressings, a tourniquet might be needed. To apply a tourniquet, you go above the area where it's bleeding and grab something that can wrap around. Something like a cord would not work that well because it's not that tight, but you would wrap it around and pull and tighten it. Tie it incredibly tight so as to stop bleeding from getting to the area. Once the bleeding is stopped, it's important to apply a bandage directly to the wound. If you suspect that the victim might be in shock, it's important to lay them down in the supine position with their extremities or whatever inflicted area above their heart and above their head. Cover the victim to prevent heat loss and activate the EMS system.